Sprains and Strains by Freeman, Jessie, Hitte, and Dora.
Ow! Oh, my ankle! Alex! What's wrong? I'm not sure. Well, is it a sprain or... No, maybe it's a strain. I don't know. What's the difference?
What is a sprain? A sprain is a stretch and or tear of a ligament. These are the ligaments that stabilize and support the body's joints. Signs and symptoms that indicate a sprain are pain, bruising, swelling, and inflammation. These are common to all three categories of sprains, which are mild, moderate, and severe. The individual will usually feel tear or pop in the joint when a sprain occurs. The three categories of sprains are mild, moderate, and severe. A ligament is stretched in a mild sprain, but there is no joint loosening. A moderate sprain partially tears the ligament, producing joint instability and some swelling. A severe sprain produces excruciating pain at the moment of injury, as ligaments tear completely or separate from the bone.
A strain is an injury of a muscle and/or tendon. Tendons are fibrous cords of tissue that attach muscles to bone. Chronic strains are the result of overuse of muscles and tendons. Inadequate rest breaks during intensive training precipitates a strain. Acute strains are caused by a direct blow to the body, overstretching, or excessive muscle contraction. Professional and amateur athletes and the general public, as well, can sustain this injury. People at risk for the injury have a history of sprains and strains, are overweight, and are in poor physical condition.
Some causes of strains could be a recent injury, lifting heavy objects the wrong way, overstressing the muscles. Chronic strains are usually caused by moving the muscles and tendons the same way over and over.
Oh, my hamstring! Dora, you okay? Oh, what's wrong? Oh, my, I think I hurt my... Did you sprain it or did you strain it? What's the difference?
The most common strains are a back strain and a hamstring muscle strain. A back strain is when the muscles that support the spine are twisted, pulled, or torn. The result is a back strain. A hamstring muscle strain is a tear or stretch of a major muscle in the back of the thigh. The likely cause is a muscle strength imbalance between the hamstrings and the muscles in the front of the thigh, called the quadriceps.
Will I need to wear a brace?
Is a brace needed? This will depend on how serious your sprain is, if you have other ankle injuries, and how your doctor thinks your sprain should be treated.
How long before I can exercise?
How long does recovery take? This depends on how serious your sprain is. Special exercises are sometimes needed to regain strength and to help reduce the chance of ongoing problems. Less serious sprains typically take less time to recover, whereas serious or severe sprains take longer to recover.
What about medicine for pain?
If medicine is needed to reduce the pain of a strain or a sprain, try taking Tylenol or ibuprofen to reduce pain.
What is the best way to use ice?
Putting ice on your injury can be very helpful, but you also need to be careful. The cold can damage nerves if the ice is left in place too long. Ice can be left on your injury for up to 20 minutes at a time. When your skin feels numb, it's time to remove the ice. Use ice treatments every 2 to 4 hours for the first 3 days after injury. Ice treatments can consist of ice packs, ice slush baths, or ice massages.
How do I wrap a sprained ankle?
How to wrap a sprained ankle. Ask your doctor to show you how to do this. Start by cutting out a horseshoe-shaped pad from 1x4 to 3x8 inch thick felt. Put this pad around the outside of your ankle joint on both sides of your foot with the open end facing up. Then wrap an elastic bandage such as an ace bandage in a basket weave or figure 8 pattern. Leave your heel exposed. Reinforce your wrap with 21 by 2 inch adhesive tape over the elastic bandage. The ankle shouldn't be wrapped so tightly that the blood flow is cut off.
For proper first aid, control swelling with the RICE therapy. R stands for rest. Rest the sprained or strained area. If necessary, use a sling or an arm for an arm injury or crutches for a leg or foot injury. Splint an injured finger or toe by taping it to an adjacent finger or toe. I is for ice. Ice for 20 minutes every hour. C is for compress. Compress by wrapping an elastic ace bandage or a sleeve tightly around the joint or limb. Elevate. Elevate the area above heart level. Rest, ice, compression, and elevation usually will help minimize the damage.
Hi, Alex. What's wrong?
I think I hurt my ankle.
Well, just remember, if it's a sprain or a strain, rice.
Rice?
Rice!
Tell me what happened. An excruciating pain came to my ankle when I was running.
I see, yes. Well, there are 3 categories of sprains. Mild, moderate, and severe. Tell me your symptoms.
Well, I first had this really bad pain, and now there's bruising and swelling.
I see. Well, I also see some swelling, inflammation around, the ankle and such. So, I think you might have a moderate sprain. Can you move your foot at all?
I don't think so.
All right. Okay. Okay. I would like you to follow the procedure of RICE: rest, ice, compression, and elevation. And we'll check back with you in a week. Okay? Okay. Goodbye now.
Manage pain and inflammation. Give an over-the-counter NSAID, non-steroidal anti-inflammatory drug like ibuprofen, Advil, Motrin, or aspirin. Do not give aspirin to anyone under the age of 18.
See a healthcare provider. All but the most minor strains and sprains should be evaluated by a healthcare provider. Consult a healthcare provider as soon as possible if there are symptoms of a possible broken bone. There is a popping sound with the injury. The person can't move the injured joint or limb. The limb buckles when the injured joint is used. There is numbness. There is significant swelling, pain, fever, or open cuts. It is important to follow up on the injury. Continue RICE for 24 to 48 hours or until the person sees a healthcare provider. The healthcare provider may want to do x-rays or an MRI to diagnose a severe sprain or strain or rule out a broken bone. The healthcare provider may need to immobilize the limb or joint with a splint, cast, or other device until healing is complete. In severe cases, surgery may be needed. With traumatic injuries, if you have bruising or swelling or can't move something, you of course need to see a healthcare provider to make sure that you didn't break something. For overuse injuries, there is a litany of things you can do. Relative rest is recommended.
Putting ice on your ankle can be very helpful, but you also need to be careful. The cold can damage nerves if the ice is left in place too long. The ankle shouldn't be wrapped so tightly that the blood flow is cut off. Ice, not heat. The old adage about ice for 24 hours followed by heat is really not believed anymore. Ice is better for pain and swelling and for getting range of motion back. You can ice after any exercise. You can even ice at night in bed. Heat is good for stretching and before exercise, but ice is always better afterwards.
Alex, what are you doing?
I'm heating my ankle.
You're not allowed to heat. Come on, Alex. You only are allowed to ice. You cannot heat.
I'm sorry, I didn't know.
God. When injured, you have an activity restriction, usually for 48 to 78 hours. This will allow the healing process to begin. During the activity restriction, you should begin to gently move the muscle or joint. That means not walking on a hurt ankle or using a hurt arm. While your strain or sprain heals, take it easy and don't do anything that could cause another injury.
tired of this rice. I'm gonna go play soccer.
Many people make the mistake of being either too eager to rush back into athletic activities after a sprain or strain, or resting the injured area too long. If you do too much too soon, you can re-injure the area. If you stay immobile, the scar tissue that forms when any tissue is injured can lead to impaired mobility. If you begin too soon, you can injure the area again. It is important to see a doctor if you have a painful sprain or strain. This helps you get the right treatments.
Ready? Watch this. Yes. Oh, I hurt my ankle again.
Strains may be more likely to happen if you haven't warmed up first to get blood circulating to the muscles. They're also common for someone returning to a sport after the off-season. That first time playing softball after a long winter off might lead to a strained calf or thigh muscle.
Here are some interesting facts about sprains and strains. Some muscle strains take longer to heal than others due to their location and function. The most commonly sprained or strained joint is the ankle. The 3 ligaments involved in ankle sprains and strains include the anterior talofibular ligament, the posterior talofibular ligament, and the calcaneofibular ligament.